want to talk about the state of the domestic HIV/AIDS epidemic and our efforts to combat it. Dr. Fenton, as we approach World AIDS Day, can you share with us the state of HIV prevention in the U.S.?
Sure. Maybe what I'll do is to begin by just reflecting on the state of HIV/AIDS in the United States today. As you and many of our listeners are aware, we estimate that there are more than 1 million people in the U.S. currently living with HIV, and we think that there are approximately a quarter of these individuals are undiagnosed. In other words, about 250 to 300,000 people in the United States are still not aware of their HIV status. Over the past decade, we've seen tremendous changes in HIV incidence as well as prevalence in the US. As people are on treatment for HIV/AIDS, they're living longer and healthier lives with HIV. But we're also seeing changes in those who are affected by the disease. We're seeing increasing numbers of minorities affected by the disease. We're seeing increases in HIV in some rural parts of the United States, especially in the southeastern parts of the US. And we're also seeing a concentration of the epidemic among those who are socially disadvantaged. And I think these are some of the challenges that we'll face as we think about prevention and control of HIV moving forward.
Thank you. Dr. Parra, as the lead for the management of the Ryan White Modernization Act, which is presently called, you focus on care and treatment. Can you tell us about the status of services for people living with HIV and AIDS?
Yes, there are many services that are provided under the Ryan White HIV/AIDS program. We're mainly concerned about making sure that people have the proper medical care, oral health care, certainly as Ms. Davis has mentioned, substance abuse treatment, other services such as support services that people need in order to get into care and remain in care. So we focus on a whole range of services. We call them core services, and we also have support services that we provide for people living with HIV. There are about 500,000 people in care under the Ryan White program, so about half of the people that Dr. Fenton mentioned are in care in Ryan White programs.
Thank you. I'd just like to take a moment to remind our listeners, please send your questions to us at contact@AIDS.gov. Dr. Fauci, as a leader in the forefront of drug and vaccine development, can you give us a status of where we are with both drugs and vaccines?
Yes, we're obviously, given what has been going on over the last several years, are doing extremely well with regard to drug development, clinical trials, and a real transformation of people who are HIV infected in their ability to lead relatively normal lives. If put on appropriate drugs, if put on drugs at an appropriate time and monitored carefully, the results have been really nothing short of spectacular. For example, last summer, there was a study that estimated from the time of the initiation of the triple combination therapy, which was around 1996, till the end of 2005, an estimated 3 million years of life have been saved in the United States alone. The data from Europe, Australia, Canada, and the developed world are quite similar. We're also starting to make inroads in the availability and accessibility of drugs in the developing world through a variety of programs, PEPFAR, the Global Fund, the Clinton Foundation, Gates Foundation, etc. We also have, which we feel good about, is that in addition to the more than 23 drugs approved by the FDA, just this past year there have been a couple of new drugs that have gotten into the pipeline and approved by the FDA that are actually directed at additional targets that would make much more comprehensive our menu of being able to attack HIV from a treatment standpoint. From a vaccine standpoint, things are not looking as well, certainly, as in the treatment. Vaccine is a particularly problematic issue with regard to HIV for the simple reason that the body itself does not handle HIV, and the immune response is not adequate against HIV. Most vaccines that we develop, you try to mimic natural infection, because in most cases, even with terrible diseases, ultimately the body overcomes the microbe and you have lasting protection. Unfortunately, that's not the case with HIV. The body does not handle HIV from an immunological standpoint. So there's a lot of work ahead with regard to vaccines.
Okay, thank you very much. Ms. Davis, can you tell us about the ongoing efforts to address HIV from a substance abuse and a mental health standpoint?
Well, SAMHSA has 3 different centers: our Center for Substance Abuse Prevention, our Center for Substance Abuse Treatment, and our Center for Mental Health Services. Each one of them actually has a capacity grant. We have approximately $112 million that we give out to grantees to actually make sure that they are connecting up people who are walking into a treatment center. It makes so much sense. If someone is walking into treatment, it makes perfect sense for them to be tested at that point, for us to make sure that we are checking them for sexually transmitted diseases, and that we are making sure that we know treatment works, but that they have the recovery support services that go with it. Treatment works, but recovery is what helps people have a lifelong productive life. And so we focus on prevention efforts to make sure that we are working with young people so that they reduce their high-risk behaviors, that we're working in treatment centers to make sure those who are in treatment get tested and referred, and that those who are in mental health centers also get tested and referred. So we connect all those efforts up to make sure that we are dealing with a population that has engaged in some risk behavior, particularly those with substance abuse, but also trying to prevent that risk behavior with the efforts that we're doing in prevention.